everybody to our Encompass WellTalks, where we invite a guest speaker each month. And this month we invited Renee, our massage therapist, who's been here for about over a year, maybe, or a year or so. Yep. And so she's going to be talking about the benefits of massage. She has demonstration placed here, and so we're just so excited to bring her here to talk a little bit more about what massage can do for you. And so I'm going to let her take it away.
Hi everybody, and thank you for coming. Tell you a little bit about myself to start. Massage was a career change for me. I was an office manager for a long time, and I made the switch during COVID. I went to school at Needed Energy right here in town. It's a one-year program, and since then I've had about 100 extra hours of trainings and certifications on top of that. For massage, we have ongoing, continuing ed, so I'm always learning new things. Some of my trainings have been oncology massage, specifically senior massage, lymphatic drainage. I've helped a lot of people post-surgery, recovering from things like knee replacements, hip replacements, shoulder replacements, which can be a very slow and difficult process, for sure, but definitely helpful in the recovery process. Helping with things like healing, scar tissue, flexibility, mobility, range of motion, those kinds of things. I initially worked for a sports massage studio where I worked on a lot of professional athletes, NBA, NFL, professional rock climbing, professional swimmers, Olympic swimmers, and with those clients, it's a delicate balance because you have to be effective, but you also have to be gentle so that you're not impeding their performance. And so, people sometimes hear about athletes and they think deep tissue, but really you can't, because if you do too much, then they're not able to do what they need to do. I also worked in a spa environment, which tends to be more relaxation, quick in and out, and I realized that wasn't for me because I like to have a personal connection with my clients, and I don't ever want anybody, myself included, to feel rushed or like they're just a number, because massage is very personal to me. I really like helping people. Let's see. So I do massage here in the wellness center. In the wellness center on this campus, and on the other campus, there's a dedicated room for massage. I can see clients on either, so if you do schedule with me, if you just let me know which campus you're on, that would be helpful so that we can actually meet up and be successful. I do have a studio right here in town in the Guilford College area, and in addition to that, I do offer mobile massage when it's necessary. People are sick or injured or can't travel to me. With all of this setup, I can travel with it, no problem. Every massage I do is fully customizable. I can do a full body massage. I have people who prefer upper body only, people who do face, hands, and feet. I prefer not to work one limb and not the other, but I will if somebody specifically requests it. And I have a volunteer, so I'm going to bring her up, and we're going to do a little work on her while I continue to talk. Hello. I don't know if everybody knows Nancy here, but hi Nancy. She is my wonderful volunteer. I'm going to have you hop on in. Let's just do face up to start. Just feet on down until your head's on the table for me, so that doesn't. traditional massage, I tend to do undressed, but I am perfectly comfortable working through people's clothes. I've done a lot of corporate massage, which corporate policy generally tells you you're not allowed to strip off your clothing during the workday. And we are going to talk about these, so I feel like we have to study them. There will not be a test at the end. And this is just a list of massage benefits. Beneficial to everybody, but particularly in this list is for seniors. Nancy, I'm going to start at your feet for a change. North Carolina law. We're a very conservative state, and so the massage laws are also very conservative in terms of dressing, undressing, draping, that kind of thing. Slide that leg over up. When you come to me for massage, we will start with an intake where we'll talk about your specific needs, your likes, your dislikes, your preferences, any discomfort that you may be having. And from there on, we formulate a plan to do your massage. Hi, thanks for coming. I think first and foremost, I would like to say that massage is not just a luxury. It can help, especially with aging, it can help with things like blood flow, blood circulation, mobility, range of motion. It can definitely be relaxation, and I believe it should be even when there's issues to work on. You'll just see Nancy's foot here that she's got some tightness ready to work. Does that pressure feel okay? Circulation, we are increasing blood flow, especially to the limbs. We can help loosen up muscles that are causing nerve impingements at times, which can definitely be a reduction in pain. And when we do massage, we're working things out of your body and out of your muscles that the lymphatic system can then carry out of your body, things like toxins and just all the unhealthy stuff, which can also help with boosting your immunity, and especially at this time of the year, that's a helpful thing. Softening the muscles, which is what I'm doing here, allows more flexibility. It allows better range of motion. In some cases, it can stave off or at least prolong the need for surgery. A lot of doctors tend to look at surgery as a first option. Things like carpal tunnel, completely treatable with massage for the most part. Let's see. Balance and gait for walking, again with the increase in mobility and the flexibility. Helping get the muscles back in the state that they need to be in, which is soft and pliable. And a lot of times with limited motion and limited activity, those muscles can stiffen up. And just over time, they can just get really, really tight, and so massage helps with that for sure. massage releases a lot of the feel-good hormones that are in the body, which can help relieve anxiety, depression, and even those hormones can help reduce your pain. They can help you sleep better when you're relaxed and feeling good. A lot of my clients report a great night's sleep the day after or the day of a massage. And arthritis, that's another issue that we can work with massage. It doesn't cure arthritis, of course, and it's not always a substitution for medication, but increasing the blood flow to the areas where you specifically suffer from arthritis can help those areas to feel better. I am trained in reflexology as well as massage. I don't typically do a full session only feet, even though I can, but I can feel in Nancy's foot, especially right here, I can feel where she's got some tightness in her spine, and I can feel that along here. So working on the feet, then I'm able to assess her body, and I can figure out the areas that need to work on them. One of the questions that I get asked often is massage painful? And my answer is, it should never be painful. If it's painful, that means that the therapist is applying too much pressure or applying the wrong techniques or tools. Sometimes there can be therapeutic discomfort, which is the feel-good kind of hurt, and that is productive. But it is not my goal to ever cause anybody pain, and especially I hear people reporting pain 3 and 4 days after a massage, and in that case, definitely people have worked too deeply. And sometimes it takes multiple sessions to work things out so that you're not working too deeply. I think there's a desire to make somebody feel better immediately, and so a lot of massage therapists just kind of want to dive right in and get everything out the first time. And sometimes that's just not possible, especially in the shoulders. Those knots didn't get there in one day. They're not usually going to go away in one day. You will get some relief, but with continued massage, you can really loosen those things up and get somebody feeling better. When I'm doing massage, I like to focus especially on the joints, even though there's not muscles there. Those tendons and ligaments in the joints also need some attention. Ankles in particular don't get a lot of focus, but if you think about them, they hold up your entire body and they do a lot of work. And that flexibility can impede the knees and the hips. Sometimes people don't feel the pain specifically where they are. Once I get working, it's hard to focus. But yeah, so sometimes I may feel some tightness in this ankle and suspect that Nancy might be feeling some pain in her ankle, but she may come in and say to me, my knees are really hurting. And I can work around the knee and I can assess the knee and find out if there's issues. A lot of times, where you feel the pain isn't the source of the pain. And so, when I work on the full body, I'm able to address all of those issues. Put your sock back on for you. That's okay. So as I was saying, when you come in for a session, we'll do a thorough intake. Then I would step out and allow you to get undressed privately and and on the table under the sheets. When I'm working on a client, per North Carolina law, all the private parts are covered and they stay covered. I do work the hips through the sheet, unless you prefer that I don't. And so basically the process is that we undrape each part as we're working, finish working on that part, cover it up and move to the next area. And again, at the end of the session, I would step out of the room, allow the client to redress, and then reconvene with them after that. There is never any reason that somebody should feel uncomfortable during massage, and if that means that you need to keep your bra and panties on, that's fine. If you want to keep your shirt and pants on, that's fine too, or any variation of that. And typically in an hour session, if I were doing a full body massage, I would spend about 20 minutes on the back. Cover up the back, I would work the hips down to the feet, turn you over, work your feet all the way back up the legs, your arms, your hands, head, neck, and shoulders. I do offer face massage. I don't always do it because a lot of people don't like their face touch or like the lotion on their face. But face massage can be super comforting. It can really help relieve anxiety. It can stop, or at least temporarily reduce things like tremors and shaking. I have accommodations pretty much for anybody. If you can't lie on your back, you can't lie on your stomach, I can still work just as effectively with a person on their side, even with a person seated in a regular chair. And I also have a massage chair, which I'm going to show you before we finish up here. Which chair massage is a better option for a shorter session, maybe 30 minutes versus an hour, because it's really best to focus on the upper body there with the neck and shoulders, with the arms even. But in terms of working the lower body, chair massage is really not the place for that. Does anybody have any questions so far? Has anybody here had massage before? Has it been recently or has it been a while? I do have cards with me, yes. The rate for my massage here at Friends Homes is $80 for a 60-minute session, which is discounted from my studio rate. Because we really want everybody here to have the opportunity to receive massage if they'd like to. And Friends Home has been gracious enough to give us that space to do that here, as well as providing the equipment for us to do that. There are two of us here that do massage. Two of us here that do massage. Barb Sample and I. Just for reference, so if you see different cards floating around out there or in the wellness areas, that's why. There are two of us. We both sell gift cards. We both sell gift cards, so I would just ask that if you do purchase a gift card from one of us, that that's the person you schedule with, and we can always direct you to the other if it's not, if you reach out to the wrong contact. Last year, I was trained in Thai massage, which is a completely different modality of massage, and it's really fun. It does require some more flexibility, but I do incorporate some techniques, such as this, which is just a gentle stretching of the hip, the knee, the ankle, and the outer band of muscles here. Again, I work right through the sheet or the blanket. Nancy gets to stay nice and comfortable under there. traditional Thai incorporates a whole lot of stretching and sort of assisted yoga. But I would say for seniors, for the most part, just some gentle techniques from Thai massage are better than the full Thai session. We're doing okay so far? You absolutely can. Sleeping during a massage is always okay. I promise I will never stop working and sit in the corner playing games on my phone. If you snore, if you drool, if you talk in your sleep, I'm accustomed to all of that. And I may be a little entertained, but I'm never harmed. Nancy, you've been coming to me for about 6 months now. What would you say is the biggest benefit?
You saw me the week after Tom died, and that helped me relax.
Wonderful. She said her neck doesn't hurt. What's the second thing you said?
My left hip.
Her neck doesn't hurt. Her left hip doesn't hurt. She feels more relaxed. And she came to me a week after her husband passed away. And so we had a nice gentle massage in that session. It was extra relaxing, I would say. Sometimes massage can cause emotional release, which is totally okay. There are a few particular spots on the body where we hold things like grief. And so sometimes we're working on those spots and people get emotional or they get very sad and they're not sure where it came from. But a lot of the tightness in our body is stored emotion. And so as we're releasing that, sometimes it does come out. Sometimes it's anger, sometimes it's frustration, it's feeling stuck. When you feel stuck mentally, sometimes parts of your body also feel stuck. And relieving those can help relieve emotionally. I'm working here through Nancy's shirt today because I didn't want her to be undressed in front of the crowd, but typically we would be working here, having her fully draped for modesty, but also being able to get into these muscles and work here. A lot of times when I'm doing massage, I will move your body, move an arm, adjust a leg. Some people are not comfortable with that. If you're not, that's totally fine too. I can work in the same position that you lie down in. I would always use caution. If you have spinal injuries, if you have any kind of previous neck or spine surgeries, those are definitely considerations. But I can still work on those. But just be a little more cautious. And when I'm working on the neck, I like to do this nice little straightening out of the neck. How does that feel? For the optimum benefit, once a month massage, we consider that maintenance. If you have greater issues and you're able, working more frequently can help kind of get things where they need to be, and then a regular monthly massage can keep things where they need to be. Since I've started working on Nancy, there's definite decrease in the tightness in her neck and shoulders. Except right there. Is there anybody here who has
looking for deep tissue, and it was a very, I call it fluffy massage, where it was kind of like
Really just applying some lotion on you.
right. It was more frustrating than relaxing. I've had way more good ones than bad there. That's good.
Good. Well, and I think that's important that your therapist listens to you and checks in on pressure. I don't know if you've been able to hear me, but I have checked with Nancy multiple times while I'm up here, just making sure that she's comfortable, that I'm not hurting her, that what I'm doing feels good. Does anybody have questions about a specific issue that they would like to see addressed in massage? Jasmine, you? Jasmine, also, can I say that?
Yes.
Jasmine also sees me for massage.
She takes care of me. She's great.
Well, thank you. In her position, she gets a little bit of stress now and then, and we help work that out. And as you know, she's very physically active, and so we're able to keep her up and running and keep her well and able to do what she needs to do here. Let's see. My youngest client has been 11, and my oldest client is currently about to turn 96. I see her every week, and I've seen her every week for the past 3 years since I first graduated massage school. And she is a resident here. I go to her room because she's not able to come to me. And she really wanted to come today, but she didn't feel like she would be able to make it down to this area. But yeah, throughout that time that I've been working on her, I've gotten to know her family members, all the nurses who come in. Got a good little routine going where the exact time that she needs eye drops is when she's on the table with her face up. So the nurse will just come in, give her the eye drops, and slip back out. We created a good little system there for her. That way her eye drops can just absorb while she's working, or while I'm working, and she doesn't have to focus on anything else. I use lotion because I don't personally like the feeling of being greasy after a massage and running immediately to get a shower. My lotion leaves you very soft and hydrated without feeling greasy or sticky or anything like that. It is the most hypoallergenic lotion available, so people don't have to worry about things like nut allergies or skin sensitivities for the most part. And if you do have any of those things, of course, I do have alternatives that we can use to keep you even safer. There's no fragrance or anything like that in my massage lotion. In my studio, I do offer aromatherapy. I don't put it on the body. It's in the room that's around you because I don't want somebody to be in the middle of a massage and start breaking out in a rash or have an allergic reaction of any kind. Kind of takes away from the massage a little bit. Stop you and move shoulders, but let's put you on the chair and I'll show how that also works. Massage can lower your blood pressure, so when you get up, it's important to get up carefully, just to be certain. This is my massage chair. This is another great option for people who can't lie down, as I was saying. Again, this is a great option for neck and shoulders. It's a different sensation in the chair, isn't it? Nancy said that's wonderful. When I do chair massage, I will often just let it hang. address those muscles, you can work on the back all day long. These are still going to pull your shoulders right back where they were. So I work along the collarbone. I work in the front of the shoulder joint, all the way around on the back. Hippie. The tight side. Nancy's coming to see me for a massage this week, so I don't want to get her too relaxed here. What else? In terms of scheduling here, I'm super easy, call or text. My phone is of course on silent during sessions, but I'm always, or at least I try to be fairly quick to get back to you and get you on a schedule. We typically do 60-minute sessions here, although I can do a 90-minute session if you prefer.
What was the last remark? Your last remark?
She can do it 90.
Oh yes, I can also do a 90-minute session. Especially if you have multiple issues that need to be addressed, a longer session can help get in there. Whereas the 60-minute session is more of an all-over, I won't say quick massage because it's still effective, but if you have multiple issues that really need focus or work, then a longer session is better, or 2 shorter sessions closer together. My hours are very flexible. My studio again is only 4 minutes from here. I'm typically here on Thursdays for certain, and then other than that, based on your schedule and my schedule, whatever works. I'm an empty nester, so I don't have anybody at home waiting for me, so I can have more flexibility than some other folks.
When you say you're here, you're at the wellness center?
When I'm doing massage, yes, I'm at the wellness center here. And then there's other days I'm here seeing clients in their rooms as well, but those are not necessarily the same day every week. I would also say primarily ladies in here. A lot of ladies like to talk during their massage, which is fine. You know, if you're getting a massage in the middle of the day and you're not sleepy, it's certainly nice to have conversation, and on my end, it's nice to have conversation too. However, I think a lot of times women feel compelled to talk, that it's socially polite not to just hop on the table and fall asleep. I am totally okay with hopping on the table and falling asleep. I typically don't initiate conversation, but if you're interested in talking, I'm happy to listen and I'll respond, of course. But I really do want my clients to be able to relax, and sometimes conversation gets in the way of that a little bit. And just looking at Nancy, just from the short time that I've been working on her, her left shoulder is about 1 inch higher than her right. And that's just tight muscles. And once I'm finished over here, if I do what I'm supposed to do, her left their first question is always, what's the weirdest thing that's happened during massage? And I've had some interesting experiences. I was working on a client a couple months ago, and I kept hearing a sound in the corner of her house, and I kept looking, trying to figure out what. She had a bird in the house.
Oh no.
So mid-massage, she was chasing the bird around, and then we resumed the massage after that. I've had people fall asleep and do like a thing with their arm, brushing right past my face, but I've not been hit. Same thing with the feet. Especially, people fall asleep and then you get down there and you touch their foot and it just starts do a little jump. I have a lot of regular clients in my practice. And typically I start out with one family member and then I get their husband or their kids or their best friend or their in-laws. And so I have a lot of families who come to see me. And it can be a little tricky because we are protected by HIPAA, just as any medical professional. And so even if it's a husband and wife, and the husband comes in and says, "Oh, did you see Mary this morning?" I can't tell him, even if he knows. And so that's kind of been an interesting facet too. I have bosses and employees who come to see me, and again, don't know that they each come to see me, or one knows and the other doesn't. So sometimes people are asking questions about those other people, and I just have to defer. But people's privacy is very important to me, and my thought in those cases is, whatever their reason is, they don't want the other person to know that they come for massage. Doesn't really matter what the reason is. It's just up to me to protect that and respect that. all the information that I had planned to bring today. Does anybody have any questions at all about massage, the process, about the room here, friends? Any? We do have a heated table warmer in the wellness center, which is really nice and cozy when you get in that nice warmth between the sheets. Helps you relax, and especially as the weather's getting colder, it feels really good to get in there and get toasty.
Thank you all for coming. I know the Wellness Center is pretty big, but if you know the health clinic where Chris is at, the room is right in there, tucked right in there. So usually you meet them right outside of the clinic or in the front.
I try to meet people in the lobby so they
The
don't have to
lobby.
look around for me. Yeah.
Yep, so right there, if you know where the health clinic is at, that is exactly where the massage space is at,
Do
located.
you have any more of those green sheets?
Sweet. I've got a yellow.
A yellow one?
Same thing. I just read out